Yeah, so
Everybody is waiting for the situation to get normal. In your opinion, is it going to be 4-5 days? And how long are going to be these 4-5 days in number of people who are losing their life?
you see, this is true that the things are really, really, very serious. Sometimes we feel like not crying, but I feel depressed at how we are not able to help since who us regularly every minute that to get a better oxygen. I personally myself, I'm doing personally. You see, rather than chasing for the beds or chasing for the oxygen bed, what I'm doing is I'm trying to help for the home care services. I have treated more than 10 patients yesterday only. That you should arrange a nurse, PPE kit nurse, and I'm giving in because the patient is desaturating about 85. They are arranging the home concentrator or oxygen concentrator at home or oxygen cylinder, and then my personal protocol is a little different what SOP is coming because everybody is confused. Even the ministry is confused. Every day different guideline. I give you one example. During the last pandemic, last wave, there was a clear-cut plasma indication. And plasma today, in this wave, that's completely not given any importance. I personally feel, as a doctor, you see, I gave you full hypothesis. What is plasma? Plasma is an antibody created by other patient and it is infused into the patient who is not suffering. It is certainly going to help, but if given in time, you wait what protocol was to give when the patient becomes moderately sick. The lung is already having pneumonia. The patches are already there. The antibodies will not work. So I personally feel that plasma even today, let them give the guideline of SOP. I completely agree with Vinay Agarwal, but because there is no clear-cut guidelines, that our physicians, we should give thought process, even whatever, whosoever is treating. Plasma in first week, if we can give, will be helpful. Secondly, remdesivir. Remdesivir is a very potent antiviral medicine. It has shown to improve some days of the decreased hospitalization recovery trial, but only in moderately sick patients, but it had not been tried in the first week. But now considering that this is not available these days, there's a mad rush. So we are thinking in yesterday when there was a Prime Minister Mann Ki Baat also, Dr. Shashank Doshi said there should not be mad rush for this because we want to avoid panic in the society. So a lot of medicines are not being used. So the best policy till we oxygen will be home care treatment with a specialist on video consultation, and we can save lives if we can give. I have started giving a 7th day patient steroid if the patient is not improving. At home, injectable steroids with the home care nurse doing it. I told you that I have more than 10 patients treating yesterday only. So this is the way where we can save life till the oxygen supply improves. Oxygen is lifeline, but why should we wait till the patient reaches to the level of oxygen? So that I agree with Dr. Vinay Agarwal that guidelines have to be still made again. Let all the physicians who are treating, not by the WhatsApp or by the television, absolutely. Messages that this is protocol. I say that ivermectin and favipiravir, again I repeat, should be started as early as possible because there is nothing else. There is no rambar. I give you one more example. I'll give you the opportunity. Monoclonal antibodies somehow were not approved in India. Why? I don't know. Why the monoclonal antibodies in the wave 1, which was something like December 2020, the same monoclonal antibodies which Donald Trump was treating, and he was away and upright on day 3 and day 4. So you see, you have to kill the virus either by your own antibodies or by giving antibody. So plasma, first week should be as good as possible. But plasma banks, Kejriwal made so many plasma banks, suddenly it has disappeared. So the protocols have to be really tight. One should not go by small studies. One small study comes, ivermectin is not useful, and they remove ivermectin from the protocol. Another study comes, favipiravir is not useful, they remove protocol. So this should not happen. And secondly, I request one more thing, very important. Steroids is being used left and right. Steroids are very important, but clearly the guidelines are that it should be used only in first week, only when the saturation is falling, and otherwise don't give in first week. Let the patient's own immunity tackle with the virus, give antiviral medicines. Steroids should be reserved for second week only in selected patients. You give steroids in first week, patient will deteriorate, and that is why this is happening. One of the reasons why the patients are deteriorating and asking for oxygen and looking for oxygen, the lungs are patches increasing, is the early steroid. I completely contraindicate that statement. I was happy to see a statement coming from AIMS in the HCMR 2-3 days back, where they said steroid should not be used. And I can tell you, my people are working in AIMS. This was being used in first week, left and right in the last wave. So I'm not saying anything wrong because the protocols are not clear. This is a pandemic, it's a new disease, we are learning and we have to keep learning, but we have to apply our own mind also. Apply your own mind. I request all the physicians through your channel, please apply your own mind before writing a prescription. And I request all the people in India who are exposed that please get yourself treated as early as possible. Don't wait and don't be in a false assurance, oh no, I'm not COVID. This is only a cough. I have getting it. So any fever, you see 30% positivity rate. Every third person is infected. So if you treat, I'm talking when you're testing it. So this is the way where you have to act fast, act swiftly, act smart. Act fast, act swiftly, and act smart. That you can reduce the oxygen.
Right, I concur with you. And Dr. Bansal, it has also been this, Dr. Gupta, in your opinion, why do you think this is spreading so sporadically?
You see, there are two reasons. First of all, this mutant virus, which is B167, which is a double mutant chain, which came from UK. We never expected that our country will be devastated. I mean, the healthcare will be like this. This is so highly contagious that you cannot prevent anybody who's getting an exposure not to be infected. Number one. So this is contagious, so it is affecting more and more people. The difference between the contagiously and virulence is different. What do we mean by virulence? Virulence means it is causing more harm to the body. That means the virus will cause more lung patches, it will cause more pneumonia, it will cause more symptoms, it will cause higher grade fever, it will cause more lasting symptoms. This wave is having this viral double mutant chain, and another chain which is coming, which is genomic analysis has been done, which is B1618, which is known, which has been found that it is also crossing the barrier and shield of double vaccination as well as previous infection. Fortunately, this B1678 is not so rampant as of now. We are having the virus which is B1667, and now I was reading today that analysis has been done that this is also divided in 1, 2, 3. That will be B1671, B1672 and 3. So these virus, definitely this is more virulent because I have been treating patients in the wave 1 also, and I am treating patients in wave 2 also. I find that many patients, it's not the lack of oxygen supply. I mean, oxygen supply will be finished when you have more numbers requiring it. In the wave 1, less numbers were requiring the oxygen, and that is why we survived. Although number were also less as compared to this. I mean, less than half around at the same time. Or we were testing less, we don't know. So this virus is causing more virulence. We have to be very careful. Sometimes we are afraid. We are treating the patient, of course online, but I go to hospital, I sit in my office. So the reason is this double mutant chain is causing more deadly disease. We are not doing genomic analysis of all the patients. Maybe it is B168, which is more virulent. We don't know. But definitely this is for sure that there are three differences. One is the fever is more high grade. That means you are seeing more 102, 103 fever, and in the previous one you were seeing 99, 100 only, or 101 maximum. Secondly, the fever lasts for at least 2 weeks, even without lung patches. Even without lung patches, those who are lucky, they will have no lung patches, they will have HRCT done, which is only very mild, very 5 out of 25 or 7 out of 25, which is not causing oxygen requirement. Thirdly, there are young patients, 30, 29, 28, 27, 40, 45, 38. This population is getting affected, which was largely immune to the wave 1. We don't know the reason. We have to be very, very careful. We cannot think that oxygen will do everything. Suppose oxygen supply comes. The whole hospitals have full oxygen supply. Even then, to save their lives will be difficult. I have patients in Apollo Hospital who are in good oxygen supply. They are not improving. They have CT score of 20, 18, 16 out of 25, 25 out of 22. They are likely to go on ventilator. So we cannot keep blaming only that oxygen is causing the death. It is the virulence of the virus. It is the contagion of the virus which is causing. We have still time to prepare. I request the ministries and the government, please make more ICUs. More ICUs. You can convert the hotels into ICUs. Bring Ayush, bring homeopaths, get them trained partially on a sort of a video training program for all the people who will be involved in the treatment plan. We are just thinking that during the May time it will go off. We were very optimistic in January, it's gone. Second wave will not come to our country. We never made preparation. Let us prepare ourselves for the worst may come. You never know, this is not the worst. Worst may still be happening. So we have to start creating more ICU beds. Just don't depend upon the number of beds which are available in LNJP or a All India Institute or any Apollo Hospital or Max or Medanta, whatever. Please prepare more ICU beds, maybe out of the places, maybe in the corridors, maybe in the parks of the hospital vicinity, where you can have a shed and more beds till we are actually sure that this virus is going or this pandemic is going. Last year, when in April I was doing the Facebook or YouTube live or taking on your channel, we were hopeful that heat will finish it off. It never happened. June, July, August, September, October 2020, it was continuing. But this virus is more virulent, more deaths. I would like to know one family where somebody distant or not has not died. It is a real situation. People not able to sleep. I got 25 calls from the morning, from Lucknow, from other places. Please arrange beds. So I would request the authorities to please start preparing for the worst now. Please don't think that virus will go off. Don't get biased by the studies coming from one IIT center that the peak will happen in the mid or May end. How can you presume, unless the God comes and tells you, one crush is coming, okay, you will be safe after June. But nobody else can predict such analysis. These analyses are misguiding. A lot of TV channels are showing that May will be finishing, June will be finishing, we'll be happy. So it is a false assurance being given. Last thing, very important, vaccination is the only thing which can protect the country. See the example of Israel. See the example of America. America of 60% population vaccinated. Why not 24/7 vaccination? Why we cannot import more vaccines? Why we should fall short? Why the door-to-door vaccination should not be done? Why the patient has to register themselves? Let vaccine be available. Let the healthcare workers go to the home and start vaccinating them. The adverse reactions are so less, so minimum, that we don't have to fear. It is a normal vaccine. So vaccination is the only thing to protect. Let us have the target of 68 lakhs per day vaccination. We are doing vaccination of only 22 lakhs approximately, which is the data which is there per day, which is very less. Please start vaccinating. We should target that the whole country should be vaccinated by the end of this year. You never know. There was a prediction. Somebody was telling that this may last for 3 years. But we don't know. I'm not going to make a panic. I want to create a caution. We have to prepare. When we know the thief is outside, when we know that people are thieves, you will like to close the door so that you are not affected. So let the country come to the whole country.
Okay. All right. So we have a caller. Ravindra Gokhale.
All the state chief ministers come together.
Right. Ravindra Gokhale is...
States government.
All right. Dr. Gupta, quick 30 seconds for you. We have run out of time, sir. 30 seconds.
Yeah. So you see, one more thing regarding vaccination. You must have heard, and a lot of people are saying, first vaccination dose, and they get COVID within 1 week or 2 weeks' time. What is the possibility? Either the vaccine has given the infection. That is absolutely not true. Vaccine will not be able to give, because Covishield has a spike protein, while it is Covaxin is an inactivated virus, so it may not. Why is it happening? My hypothesis, and I was talking to a lot of friends and my cardiologist friend, vaccination drive all over India is being done in a small corridor, a small door, closed apartment, where there is a curtain or is a closed chamber. And the virus, this is now possibly airborne. Somebody comes with infection and the virus stays there. I request that we have to change the planning. Let it be open air vaccination. It should not be inside the small room. Even in our hospital, airborne whatsoever. And when maybe the patient comes in the car hospital, let the person go and inoculate him in the car and let him stay there. So we have to change the policy depending upon, we have to dance according to the tune of the society. So we have to do the changes. We have to do the changes, otherwise the whole country will be in shambles. Please, this is the time we have to really work hard. We cannot be just thinking that May will be finishing or June will be finishing.
I completely
Of course, it happens. I will most happy.
It's also not the time for blame game. It's the time for us to come.
No blame game. No blame game. No blame game. We have to learn.
Crisis head on. I'd like to thank all the panelists for being a part of this wonderful show. We dip into a short break. Be right back.